Hashtag I'm from Denver, and if you have been injured in an automotive, motorcycle, or trucking accident, you need to keep watching this because Dr. Dan, real talk, real doc, he specializes in just that very subject with Denver Pain and Spine. And so if that's been you or you know someone who's been affected by that, we're going to get answers for you, but just informative facts, right, Doc?
Absolutely. This is informatics. This is for you to understand what to do when you're involved in an auto, trucking, motorcycle accident.
Great. And so what do you do? Because here's what's funny is you almost first think, I'm going to call the cops, and then if it's really bad, let the insurance company handle it. That is almost last. And you tell me, do you see people not come in to get health checked?
Absolutely. They're more concerned about their car, and they're not thinking about what happened to them.
Yeah, so then what are they supposed to do? Just call you right away?
Yeah, the first thing is after you freak out, right? Everyone freaks out after an accident. Then you need to calm down and assess yourself head to toe and say what's hurting, what's not normal, and then definitely be seen by an ER doc or an urgent care doc within 24 hours. Yeah. Okay, you want to make sure nothing's broken that needs immediate fixing, right?
Okay.
After that, then take your time over the next week to find me. Come on in, we'll do a head to toe and figure out what was missed in the urgent care environment and then set you up with a treatment plan so you get better.
Okay, now that if you're watching this, you know, and if you've been in those auto accidents or trucking or motorcycle, you know Dr. Dan knows this stuff, but you don't know about Dr. Dan. So Dr. Dan, I think you need to do, and I don't mean to put you on the spot, but I think you need to do a little bit of braggadocious. I've walked into your office.
Introspection.
I think so. I've walked into your office. You see, I mean, we could put all your plaques on, your degrees on plaques. That shows you how uneducated I am, but we see all your degrees on the wall. Tell us about you and tell us like what your expertise is.
Okay. So first thing, I'm a medical doctor, right? So I got a doctorate in medicine, which means I did study at some time and I did make everyone proud of me at some point. But then I went on, right? And so you do specialty training, and my background's anesthesia. So if you've ever been with an anesthesiologist, you know we have to know everything because we have to sleep you, we have to bring you through your surgery and bring you back again.
Yeah.
And so that's my background. And then I've spent 20...
That's a lot of pressure.
Well, it's a lot of pressure. But then in 28 years, I've done a lot of injury. So I've learned all these different parts, right? The head piece, the body piece, the spine piece, all these different things, because you got to have someone that knows what they're doing.
Okay, wait. When you say learn, so you went back to school, you became an anesthesiologist, and forgive me, I know I can't even pronounce half the words you tell me, but you did that, and then you're like, I need to learn about these injuries, and then you went back to school, like, or did you ever stop going to school?
Yeah, so I was also a visiting professor at a lot of places all around the world. So, you know, my background is anesthesiology. That's what we call our first board. That's the first major test I had to take. Then my second board is interventional spine and pain medicine. That's the second board I took. And so with all that, yeah, you keep learning, right? Just like any other profession, you got to keep learning.
Well, I'd hope so if I'm a patient of yours.
Well, sure. You're hiring me to tell you what I think after 30 years experience, right? And so
I didn't mean to interrupt. Finish your whole background.
So I'm there to help you figure out what's wrong, and then we'll get it fixed.
Yeah. And so what did you do when you kept learning? What you were talking about that, and I interrupted you.
No. So you keep learning, which means you go to courses, you read literature, you do all these things. You watch other docs that are better than you so you can learn their skill set. Mm-hmm. You bring that back and you keep doing it. That's why we call it the practice of medicine. Yeah. Right? You're constantly practicing and getting better and better and better at what you do.
And so you were just seeing injuries, and now you seem like a very selfless guy, right? So to me, was it just more of like you could learn about this and you knew you were going to help people, and then that's kind of how you approached it, or what was the goal?
Well, yeah, I got into this originally with chronic pain. Okay, so
you personally?
No.
Oh, okay.
Patients, devastated, right? Coming to me with scars from the back of their head down to their butt. Had tons of equipment in them. Rods in their legs, screws in their back. And that's how I started. Okay, so I was dealing with really bad pain people, right? They had terrible pain problems. And then as I got into injury, I realized, we can avoid a lot of this. We could prevent the chronic pain from happening. Mm-hmm. And so that's very rewarding to be able to talk to someone and say, look, I could show you a dude that's been with me 25 years who has terrible pain, or I could show you how to prevent that.
Wow.
Right? And that's very rewarding when someone says, hey, doc, I feel great.
Yeah.
I'll send you a postcard, send you a Christmas card. We'll keep in touch once a year. That's the perfect thing a doc can hear, because then you know you've made a difference.
Well, we started working together. It was video testimonials, and surprisingly, it's been a crazy year for everyone, but the year seemed to go by so slow, fast, however it impacted you. We've been working together for over a year now.
I know.
I was like, oh my gosh.
It's amazing.
Time flies.
And we haven't killed each other.
Yeah, you haven't got rid of me yet. I'm like, I got to keep making these podcasts awesome. So you guys better share this, by the way. Hashtag I'm from Denver.
Absolutely.
But when it comes to your expertise and helping people with these back injuries, we've been filming these testimonials. People they're in tears, and and the thing is I've tried getting other testimonials for clients. It's hit or miss. When Angela called people to see if they could, your patients, former patients, if they could come in, all of them almost dropped what they were doing and they all came in. Yeah. It's like you really do change lives.
Well, and that's our goal, right? Our goal is to use medicine to help you get better.
Yeah.
I would love to have groups of people that just send a card once a year and say, hey, how you doing? Hey, we're doing great. How's the family? Versus someone has to come back all the time because someone missed something years ago and now they're stuck with their pain.
Yeah. And so now with automotive, motorcycle, and trucking accidents, you have to see an array of injuries and
all kinds of injuries.
How do you even start with that? Or what does someone do in that situation when they've been hurt in an accident and they come to see you? Like, they probably have so many questions. They don't think anyone's going to help them. Like, I don't know what the average patient does when they come to see you.
You know what the best thing is? People need to be introspective, right? Start thinking about yourself. So start sitting down with a piece of paper, girlfriend, wife next to you, write down everything that's not normal. That's the first place to start. Right? You know what your normal life is. If you climb rock every summer and you ski every winter and you hike and you bike and you do all this stuff like most Coloradans do, you know what's wrong. I can't bike. I can't climb. I'm pooping out at the gym. My head's hurting all the time. I can't think straight. I can't remember my kid's name. Those are issues. So write down the issues. That's all you have to do. Bring the issues in with you, and then we'll figure it out together.
That's awesome. And then now when it comes to like having to work with lawyers and all that stuff, is that a process as well? Because I mean, I can imagine having to deal with that, because when they come in here, they're probably because you tell me you have to go to court all the time.
Yeah. And so here's the thing you need to know about auto, trucking, motor. You need an advocate in law and you need an advocate in medicine. And the reason is I can't help you with the law. Don't even ask me. Okay, that's not what I do. But your lawyer can't help you with medicine. That's not what they do. So you want to get better, number one. You want to get the right remuneration for whatever injury you have. And you need both. So I always tell clients, come on in, let's do the medical workup first. Let's make sure we haven't missed anything, that if we don't treat it right away, you're not going to be hurt in the future. After that, meet with an attorney.
Yeah.
Find someone.
Get healthy first.
Absolutely. and let your attorney do their job.
Yeah.
Right? Don't let me do their job, and don't let your attorney do my job. We work very well together because I think all of us have the same goal. Get you better, get you remunerated for whatever injury you have, and get on with your life.
Yeah. Yeah. So if you've been in an automotive, a motorcycle or trucking accident, or even a slip and fall, we talk about that.
ATM, auto, trucking, motorcycle. Right.
But you need to see Dr. Dan, Denver Pain and Spine, #I'm from Denver. And again, we bring you these health segments all the time just to give you information and facts. I mean, that's the main reason for Real Talk, Real Doc.
Absolutely.
But it's also to get us connect with you guys in the Mile High City. So if you have any questions or you need anything, leave a comment below or go check out imfromdenver.com/Real Talk, Real Doc.
Real Talk, Real Doc with Dr. Dan.